Greetings, alumni. For those of you that don't know me, my name is Mark Bonica. I'm an associate professor here in the Department of Health Management and the current chair. So I wanted to give you another update about what is going on. And I just want to say it's a privilege to be here at UNH and a privilege to lead HMP. It's hard for me to believe, but 10 years ago, this past January, I started my second career here at UNH. And it's been a wonderful journey so far, getting to know and teach many of you. So thank you. And if you haven't been seeing my posts on LinkedIn, reach out. Please reach out. I'd love to connect with you. But it's internship season. We have 26 juniors looking for internships right now. So if your organization would be interested in providing a high quality, paying internship for one of our students, please reach out and let me know. So far, we've got 13 placed, which is not bad considering it's just not even halfway into February. All of them are in paying roles. They're all really great organizations, so I'm really excited about that. I've got a little over a month to get the rest placed to hit my goal of having them all committed before spring break. So we'll see if we can do this year. I've been kind of holding off. I keep holding off on sending out these updates because stuff keeps happening, but I'm going to go ahead and pull the trigger here and tell you we had some bad news yesterday. President Chilton announced yesterday that UNH is going to have to find a $20 million to cut from our budget. This is coming from the result of some modest declining enrollment, but more a change in the demographic mix. We've got more in-state students versus out-of-state, as well as we're hearing that there are projected cuts coming from the state. So we don't get a lot of funding from the state, but given the fixed nature of our expenses, even a small cut has a large effect. So what we know right now is the dean has been asked, so Dean Corazzini, dean of HHS, has been asked to develop plans for cutting somewhere between $1 and $2.5 million from the college. That's going to be tough. And we don't yet know how this is going to hit HMP or if it will. We've already given up an awful lot. We're down about 30% full-time faculty since I started 10 years ago. So there isn't really a lot left to cut from HMP. We're basically running at the bone. But we're gonna do what we can. As I've talked about in our previous videos, we are on a mission to increase enrollment in HMP with a goal of getting 200 people enrolled, and that's in part to make sure that we are protected from future potential cuts. We want to make sure that we're contributing value to UNH. So to that end, some great news. I mentioned previously the MPH conversion from a part-time program in Manchester on the Manchester campus to a full-time in-person one-year program here at Durham campus was approved. So that's people are going to be able to come and complete their MPH in 12 months. So I think that's going to be amazing. David Lee is leading that transition, and we are planning to have a fall start. So we have some exciting things about this. We've received permission to cap tuition at $7,500 a semester. We run two terms in a semester. It's going to be very intense, but at $7,500 a semester, that's basically 2 semesters and then some summer courses. So students are going to be able to come to UNH, to our MPH program, and graduate with their MPH with under $20,000 in tuition costs. Now, there's going to be other fees, but that's a bargain. We also, very exciting, we also have 4 partial grad student scholarships to offer this year, which is a first for us because in the past, we haven't had a full-time program to assign graduate students to. So these partial grad student scholarships will cover half of their tuition, half of the students' tuition for each semester, plus a modest stipend. So it's really exciting. We're looking forward to getting applicants and building that first pool. So if you've been thinking about getting your MPH and you want to get it done in a year, well, not under a year, it'll be a year, and it'll be intense, or you know someone who is interested, please send them our way. This is going to be a great program, and we're really excited about it. Also, in the same lane is we had proposed a bachelor's of public health, or a BPH, and that was approved at the university level and will hit the catalog officially in March, which means that students will be able to matriculate into our bachelor's of public health program starting in fall of 25, or they can transition over from another major. Our approach to the BPH was really creative. We're using about 7 existing HMP courses, and then we borrow about 7 more courses from other UNH departments that address different aspects of public health. So we have all these amazing departments and courses being offered at UNH, many of which address different components of what it means to care for the health of our community. So, for example, students are going to take a GIS course, which is all about mapping using satellites to be able to look at and calculate, the spread of disease. So that's the kind of thing we've done, and I think it's really great. The only course we had to recreate one new course, and that was the capstone, an experiential capstone. So students will do their didactic work, and then in their spring of their senior year, they'll do an experiential capstone. So basically, to create this whole new degree, the cost to the university is about less than $10,000 a year. So we're really excited about that. So if you know young folks who are interested in getting their bachelor's degree and they're passionate about community health, and the health of the public, send them our way. And this approach has been observed by the college, and we've been receiving praise and been called out in a couple of meetings for our creativity in creating this degree plan, because it's collaborative rather than competitive, right? We're breaking down silos. We're using resources that are available at the university to create something new. So given the budget environment we're in, this is the kind of thinking that all departments are being encouraged to engage in, and we're at the forefront of that. So although it's going to take a few years, we're conceiving of this kind of as a 4+1 program where students interested in public health will be able to come to UNH, get their bachelor's degree, and stay on one more year and graduate with an MPH in 5 years, which is really an exciting approach. The hope, of course, is that this will grow enrollments in HMP and continue to protect the department. So as the MPH gets relaunched, we're also visioning bringing back the Masters of Science in Health Data Science in a similar one-year format in person. I think this would be an amazing master's degree for HMP students who are more interested in the administrative side. They'd be able to come out with really high-powered data analytic skills that I think would be very valuable in today's market. And that also would be a potential 4+1. So we could have kids, leaving after 5 years, not only with their undergraduate in HMP, but their master's in data science. HMP is all about leadership and innovation. So in that same spirit that we created the BPH, we've also started looking at a collaborative degree working with rec management, social work, and nursing that would focus on long-term care management. So looking at, preparing students to go out and lead assisted living, lead nursing homes, which we already have a lot going into these fields, but to kind of redesign an experience that would integrate some of the great courses that are being offered in our colleagues' departments, and make them even better prepared for this rapidly growing area. So that's something we're thinking about. It's coming hopefully down the road. I'll definitely keep you in the loop on any of those changes. So we've got some challenges ahead, but HMP is about leadership, innovation, and breaking down barriers and creating opportunities. I'll make a point of keeping you updated as we navigate these rocky waters ahead. But I just want to say, as always, that we appreciate your ongoing support. HMP would not be what it is without our alumni commitment. So thanks for listening, and it's a great day to be a Wildcat.